This is the Florida Healthcare Association Provider Program, brought to you by Bouchard Insurance.
Good morning, Mr. Chairman and members of the committee. As the chairman said, my name is Tom Parker, the Director of Reimbursement with Florida Healthcare Association. We are the state's largest nursing home association, representing over 550 nursing homes all over the state. Thank you for the opportunity to address the committee today. In 2017, the legislature passed a new Medicaid payment system for nursing homes. The prior system had been around since the 80s and was really just kind of cost-based. There were some limits placed in there, but nursing homes were strictly paid based on whatever their costs were that they submitted to the state. So what we found under that system is you had some nursing homes who had really high cost and were getting really high rates, but they didn't necessarily have high quality numbers to go with that. And then conversely, you had some of the best nursing homes in the state on all of the quality measures were doing it very cost efficiently and didn't see the additional reimbursement. So the legislature passed through Senate Bill 2514, and the new payment system is a prospective payment system where nursing homes are paid similar cost for similar services, but it has a strong quality component, and nursing homes are finally rewarded for the first time in Florida's history for providing high quality of care. So that system just took effect in October 1 of this year. Last year, yes. I'm still getting into the new year. Thank you, Senator. Kind of on top of that, during the 2018 session, the legislature put some additional funding in the budget for this new system. There was $138 million in non-recurring funds put in the budget, earmarked towards the direct care component and towards improving quality in nursing homes. So I want to kind of give you guys where some of that money is being used now and to hopefully make the case to renew that funding going forward when you're making those tough budget decisions. So the new system significantly ties reimbursement to quality. So with that additional funding that was put in, $259 million of the nursing home line item is tied to paying for these quality improvements. That's 8.5% of the nursing home budget is what's tied up in these quality improvement points. Providers are scored on a series of nationally recognized quality measures, things like direct care staff, their CMS 5-star rating, different quality measures like ensuring flu vaccines are being administered, reducing resident falls, and then several state and nationally recognized quality awards or accreditations. So on each measure, providers are scored against the other providers in the state and awarded points with a maximum score of 40 points. So currently the average in the state is about 15.5 points. So providers are doing well, but there's always the opportunity to do better there. There's no add-on for lower performing providers. And so those who do receive an add-on, the average right now is about $21 a day. So just to kind of give you an idea, an average size nursing home has about 25,000 Medicaid days a year. So it's over $500,000 in additional Medicaid reimbursement that they're seeing with those dollars. So it is a significant connection there, and there's a strong reason to work on those measures. So when you compare the numbers from prior to the legislature passing the new PPS in 2016 to where we're at today, so we've got data through the midpoint of 2018 currently available, we're seeing significant statewide improvements. 7 of the 8 quality measures that are included have improved over that time. The one that hasn't is down about 0.1%, so it's a small issue there, but we're working on it. We're offering some training to our members on how to continue to improve on that measure. Some of the bigger changes we're seeing is in the use of antipsychotic medication, which has long been a push of the federal government and of the provider industry. It's down 13% from where we were at just 2 years ago. And then on reducing pressure ulcers, we're down 33% from where we were at 2 years ago on that. So we're making very positive improvements in those areas. Florida now has 72 more 4- and 5-star buildings than we had prior to implementation, which puts us second among all states in total 5-star and third among all states in 4- and 5-star buildings. So the 2 states that are ahead of us is California and then Ohio, but they both have, so California has about twice the number of nursing homes, and Ohio has about 50% more. And we're right behind them on both of those categories. And we also have 338 providers who are now receiving a National Quality Award or accreditation through the Joint Commission, through the American Healthcare Association, which is a Baldrige-based award, or the State Governor's Gold Seal Award, which recognizes high-quality providers. And all of these awards signify that the provider is on a continuous quality improvement journey. These are not awards that you get because you're done. These are continuing to move forward and you've put processes in place to kind of continue to move this system forward. In addition to quality, some of the additional money was also appropriated last year for direct care, and that goes to cover the salaries and the benefits of your nurses, your RNs, your CNAs, those folks who are really providing the hands-on care in the building every day. Florida currently has the highest level of mandated staffing hours in the country, so this money in direct care really kind of helps providers meet those requirements. And we rank 9th amongst all states and 1st among the 10 most populous states for actual staffing rates of the staff that's actually in the building. So providers are using some of this new money towards staff pay raises, retaining good staff, hiring new staff, and hiring more specialized staff. As you know, the nursing home population has really changed over the last 10 to 15 years. So we're doing a lot with regards to hiring more social work staff to help deal with behavioral challenges, making improvements in dietary and nutrition services. We're seeing a lot more of a push towards open dining and round-the-clock 24-hour dining options available. Residents want more choice and more freedom, so we're making those options available.